As the world struggles to cope with the effects of the COVID-19 crisis, it is worth remembering we've been here before. So as Canada and other countries around the world consider how to get back to normal life, can parallels be drawn between this pandemic and the 1918 pandemic? We can avoid the second wave that our ancestors observed? Can we, though? Laura Spinney is a science journalist and author of Pale Rider, the Spanish Flu of 1918 and How It Changed the World. She joins us now from Paris. Laura, thanks so much for joining us. They say those who don't learn from history are condemned to repeat it. What parallels can we draw between the two pandemics?
As you mentioned, there was a second wave of the 1918 pandemic, which was by far the most lethal. The vast majority of deaths happened in that second wave. But I think what's really interesting is that from the little we know about this virus, we know a little bit more about coronaviruses in general. They don't change as much as the flu virus. And it looks as if the flu virus in 1918 mutated between the first two waves. So it seems that that will be less likely this time, but we are still vulnerable to a second wave. The point is that if we have a second wave, it'll probably come down to human behavior, and if we haven't taken the risk of this disease seriously enough.
So in terms of the way the 1918 flu developed and the public awareness, actions taken by the public, can we see parallels or can we see warnings in the way governments and individuals are reacting and dealing with it now?
I think so. I think it's really fascinating because we're in this period where we don't have a vaccine. The experts tell us that a vaccine won't be ready for 12 to 18 months. And that means that the only way we really have of preventing people from getting sick, or at least slowing the spread of the disease, is these so-called social distancing measures, lockdown being the kind of collective term, the kind of the most extreme. But that's all we've got. And those measures, isolation, quarantine, masks, hand washing, all the rest of it, those are not new. Those have been around forever. And they're what they used in 1918 when they tried to make vaccines, but they didn't work. So in some ways, there are huge parallels. And we're having all the same debates they had then, like, do masks work? Do they protect you? Should you only wear them when you're sick, and so on?
500 million people around the world affected by the 1918 pandemic. Nowhere near that yet in terms of numbers, but you who've studied the 1918 pandemic, were there signs that you saw that made you think, aha, this could get bigger in terms of observing the way we have come to deal with the potential enormity of COVID-19?
I mean, I think so I wrote my book 2 years ago because it seemed to me that people had forgotten about this terrible disaster in the early 20th century, which was the biggest catastrophe of that century, far bigger than the world wars. And now it's all we can talk about. And it's with the Spanish flu of 1918 that we draw these historical parallels. But there were other flu pandemics in the 20th century which were much smaller and which might be a better comparison. So there was the 1957 so-called Asian flu, which killed not more than 2 million people. The 1968 Hong Kong flu, which killed not more than 4 million people, for example. I mean, those are big numbers, but they're nothing like the 50 million that the Spanish flu killed. So they might be more appropriate comparisons. Obviously, we have no idea yet how many people are going to die in this pandemic. We hope it's many fewer. And as I say, there's an element of it depending on our own behavior now, especially now as the lockdowns are going to be lifted.
You talk about behavior being so key, and certainly we're hearing this from health officials right around the world. But when you look at pandemics, are there similarities? Are there mistakes repeated every time that you'd like people to know about now that we can perhaps avoid with this latest pandemic?
Yes, there are. I mean, we do learn from every epidemic or pandemic that happens. We learned a lot from Ebola, for example, but perhaps not enough. For example, the WHO has been telling us for a very long time that in order to prepare ourselves as a globe for the next pandemic, we need to invest collectively in the health infrastructure of the poorest countries, because we're only ever as safe as the least safe place. And that kind of goes with the idea that this won't be over anywhere until it's over everywhere. And we don't really do that. We haven't done that. The WHO has repeated the message this time. It kind of goes unnoticed. And that's one of the key things we could really do once this pandemic is over to protect ourselves against future ones, because there will be future ones.
Okay, we will try to learn from the history as you brought it to us, Laura. Thank you so much. Really appreciate your time. Laura Spinney is a writer and science journalist, and she joined us from Paris.